Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm. I am a retired consultant surgeon and throughout my career I had a particular interest in the care and treatment of cancer patients. Presently I am chairman of the Isle of Man Anti-Cancer Association.
Hello, I'm Sandy, Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor. For any listeners unfamiliar with us, the association has been in existence for over 60 years. In that time, it's raised and distributed over £22 million for the benefit of island residents affected by cancer, through funding research for better understanding of the condition and new treatments, the provision of equipment and facilities on the island or where Manx cancer sufferers receive treatment in the UK, and in particular in recent years to promote greater awareness of the disease. In this podcast, we would like to talk to you a little bit about male cancer awareness. There is a striking and concerning statistic: men die on average several years younger than women. Two important conditions that contribute to this reduced lifespan and which men can do something about are testicular and prostate cancer. Testicular cancer is the commonest cancer that affects men aged between 15 and 49, whilst prostate cancer is the commonest male cancer overall. Men, most of whom consider themselves to be alpha males, often consider that they are invincible and have a laissez-faire attitude to many things, including any potential health issues. Being aware of the signs and symptoms of these conditions and getting checked out early can improve survival. So Malcolm, can you tell us a bit more about testicular cancer? What should men look for?
Testicular cancer affects about 2 men each year on the island. The most common symptom of testicular cancer is a lump or swelling in part of one of the testicles, known to some as the balls or the nuts or many other names, probably not mentionable on the radio. The lump can be as small as a pea and will usually be in one testicle only. The majority of cancerous lumps are painless. Another symptom can be a heavy or dragging sensation or even a dull ache in the scrotum or ball sac.
So what can men do to find this lump early when it's just started to develop?
Check your testicles regularly. Get to know your balls, either by self-examination or get your partner to do it. Know what feels normal for you. It doesn't take long to do, just a couple of minutes once or twice a month. Roll each testicle gently between your forefinger and thumb. There's no need to squeeze. Best done after a warm bath when the overlying skin is more supple. Feel for any lumps or bumps. Assess their size and texture or firmness. There are many simple causes of lumps in the scrotum, and finding a lump doesn't mean you definitely have cancer. But if you do find a new lump in the scrotum, get it checked out. Don't just, excusing the pun, sit on it. Sandy, can you tell us about the symptoms of the most common male cancer, prostate cancer? What should men be concerned about?
Well, the prostate is situated at the neck of the bladder, and most symptoms relate to narrowing of the outlet of the bladder as the tumour develops. So the common symptoms of prostate cancer are weak or slow urine flow, passing urine more frequently or urgently than usual, particularly noticeable throughout the night, difficulty in starting to pee, a pain or burning sensation during urination, or an unexplained urinary infection. In most men, these symptoms develop over many months and often arise as a result of non-cancerous enlargement of the prostate, and that can occur with age anyway, but you should see your doctor and get things checked out. Occasionally, other symptoms may include impotence or erectile dysfunction, again not an uncommon problem in men over 55 for other reasons, constipation, blood in the urine or semen, and pain in the back with no other obvious cause. So, can you tell us a bit more about the PSA test, Malcolm?
As you point out, there's something called the PSA test. By the way, PSA stands for prostate-specific antigen. PSA is a protein produced by normal cells in the prostate, and its function is to liquefy semen in the seminal coagulum and allow sperm to swim freely. In relation to prostate cancer, the PSA test is a blood test which looks for increased levels of this protein. An increased PSA level can be an indicator of prostate cancer. But the PSA level increases normally in individuals with age as the prostate enlarges. And 2/3 of men with a raised PSA do not have prostate cancer, while 20% of men with prostate cancer have a normal PSA. Therefore, the PSA test used on its own is not suitable to be used as a screening program. However, most GPs will offer this test to men over 55 who present with symptoms. There's a third male cancer which is very rarely talked about, penile cancer. Sandy, can you tell us a little bit about this?
Certainly. Penile cancer is a rare type of cancer that occurs on the skin of the penis or within the penis, usually in men over the age of 60. The common symptoms and signs are a thickening or change in colour of the skin of the penis, a flat growth similar looking to a wart or sore on the penis, and a discharge or bleeding from under the foreskin.
We're talking about male cancer. What should anyone do if they are concerned about something, Sandy?
Well, the first step, as always, is go to your GP. As we said before, for some blokes it's an embarrassing thing to talk about, but the doctor will have seen it all before and would prefer that you got it checked out. Results from treatment of male cancers have improved considerably in recent years, but earlier presentation will always result in the best outcomes.
And where can anyone get more information?
For more information, you can have a look at ORCID at orchid-cancer.org.uk, or you can phone them on 0203 465 5766. They've got a fabulous website with specific information for blokes about testicular cancer, which is yourprivates.org.uk, or for prostate cancer, there's also prostatecanceruk.org. And of course, Macmillan Cancer Information Centre, based at Nobles Hospital. You can call them on 650735, or you can visit their website, which is macmillan.org.uk. And for any information on Isle of Man Anti-Cancer Association, you can visit our website on iomaca.org.im. Thank you so much for listening.